Have you noticed that the physiological parameters of your beloved elderly relatives are undergoing subtle yet crucial changes? Those appearances that are mistakenly regarded as gifts of time often hide the biological signals of the body's decline. There is a common misconception and general understanding that the decline of old age functions presents sudden characteristics. In fact, the human body's sophisticated system often activates the compensatory mechanism 12-18 months in advance. The core problem lies in the fact that these biological markers are easily confused with natural aging. The initial changes are often attributed to physiological degeneration. By the time the family members become aware of it, the optimal intervention window has already closed. They miss the golden period for creating precious memories, implementing palliative care, and maintaining the dignity of life. Analysis of the clinical early warning system. This film will reveal the 5 most clinically predicted biological markers before the end of life. Some of the signs may have already been captured in daily observations, but they are misjudged as insignificant. Some slight variations are actually the early compensatory manifestations of multiple organ failure. Identifying these signals in a timely manner can optimize palliative care strategies, improve the quality of life index. More importantly, it adds a footnote of dignity and peace to the final chapter of life. It is recommended to watch this film in its entirety. Mastering this early warning knowledge will give you a double initiative in both emotional preparation and practical response. When you understand the biological process of the end of life, you can calmly grasp every precious moment and transform the limited time and space into an infinite celebration of life. The first key indicator: involuntary weight loss. When the elderly enter the final chapter of their lives, the most diagnostically valuable initial sign is the unexplained decline in the weight curve. The initial variations may be hidden in. The belt holes are adjusted inward month by month. The size of regular clothes gradually becomes looser, or the proportion of food remaining on the plate increases. Most caregivers attribute this to natural aging. In fact, involuntary weight loss often indicates that the body has entered a stage of metabolic reorganization. The manifestations include: the threshold of nutritional metabolism efficiency is broken through. The skeletal muscle groups are decomposed at an accelerated rate. The homeostasis of the internal environment gradually collapses. Explanation of the pathophysiologist mechanism. Although age-related muscle loss is within the expected range, if the monthly muscle loss rate is 2, it indicates a potential organic disease. Common causes include the dysfunction of the digestive enzyme secretion system, the obstruction of protein anabolism. This leads to the decomposition rate of muscle fibers being the synthesis rate. This process not only reduces the level of mobility function, but also significantly increases the risk coefficient of falling OR value 3.5. The probability of penetration of the immune barrier are valued at 0.8. The susceptibility to nosocomial infections. The interactive influence between metabolism and nerves. The core pathogenic factor involves the decline of the feeding drive. The elderly often experience the blockage of the hunger signal transduction pathway, the decrease in the sensitivity of taste receptors. This in turn leads to the meal amount decreases to below the basic metabolic requirement. This is not a simple change in dietary preference. It is actually the degeneration of the function of the feeding center in the hypothalamus, accompanied by a systematic decrease in the energy metabolic rate or MR. A vicious cycle of malnutrition or copenhagen frailty is formed. The early warning value for multiple system diseases. Involuntary weight loss is often just the tip of the iceberg of multiple pathological processes. Chronic inflammatory storm CRP NGL. Combined heart and kidney failure EGFR 45. Neurodegenerative diseases NSE 24. Even mental and psychological disorders GDS5. It may induce a tendency towards anorexia nervosa, establishing a closed loop of inadequate nutritional intake, decline of organ function. Clinical nutritional intervention suggestions. Some families try to provide metabolic support through the supply of highly palatable foods, the intervention of protein nutritional supplements. If the weight curve still shows a negative drift, it is necessary to clearly recognize that this is not a simple nutritional problem, but the end metabolic mode of the life system has been activated. Forcing nutritional enhancement at this time may have the opposite effects. Better strategies include implementing comfort-oriented feeding. choosing high nutrient density fluids, maintaining the balance of water and electrolytes. These measures have significant evidence-based medical value for improving the quality of life. Index QOL score 15. Guidelines for life care. How should we treat these subtle signs gently when the body sends them out? Introduction. When the ship of life is about to reach the harbor, the body will quietly release special signals. These signs are not only physiological changes, but also precious opportunities for emotional connection. Let's interpret these life codes from a professional perspective and write the final chapter with warm company. Chapter 1. Exhaustive fatigue and physical decline. In the terminal stage of the life cycle, about 80% of individuals will experience persistent physical exhaustion. This physiological state that exceeds normal fatigue has three characteristics. 1. Irreversibility. It cannot be relieved even with sufficient rest. 2. Progression. Daily activities are gradually restricted. 3. Comprehensive variances. It affects basic life functions. Clinical observations show that the time taken to get up in the morning increases by 300. The energy consumption for indoor movement increases to 2.5 times the normal value. The completion rate of basic self-care activities decreases by 60-80. Analysis of the physiological mechanism. When the heart's pumping efficiency drops to a critical value, usually 35 ejection fraction, the body activates the survival first mode. 1. The peripheral circulation flow is reduced by 40. 2. The muscle oxygenation level drops to 60 of the baseline value. 3. The metabolic rate is adjusted down to 0.8 times the basic metabolic rate. Psychological and sociological influence. 68% of the interviewed elderly people said they have anxiety about losing their abilities, and this emotion may lead to the rate of social avoidance increases by 45. The incidence of loss of interest increases by 70. The sense of self-worth drops to 30 of that in youth. Family support suggestions. Establish the concept of energy budget and respect the individual's activity threshold. Use assistive devices to reduce daily energy consumption by 30. Arrange 3 for micro-activities every day less than 10 minutes each time. Chapter 2. Metabolic reorganization and fluctuations in wake-up signals. The metabolic regulation in the terminal stage of life presents a unique biphasic pattern. Daytime phase, protective dormant state 14-18 hours a day. Wake-up signals phase, the intermittent cognitive active period 20-50 minutes each time. Clinical features include the dispersion of the circadian rhythm increases by 80. The frequency of sudden wake-up signals periods is 2-3 times a day. The efficiency of energy reserve redistribution increases to 120. Key points of care. 1. Seize the golden communication window. Have important conversations during the wake-up signals period. 2. Create memory anchors. Use short-term interactions to establish emotional connections. 3. Increase the proportion of nonverbal communication to 40. Chapter 3. Cognitive reshaping and emotional precipitation. The cognitive changes in the terminal stage present a wave-like evolution. The efficiency of short-term memory access decreases by 60. The speed of semantic processing slows down to 0.5 times. The accuracy rate of spatial-temporal positioning remains at 70 of the basic value. Guidelines for emotional interaction. Use the reminiscence therapy to increase the participation rate in conversations by 35. Establish a nonverbal emotional account. Increase the frequency of physical contact to 2 times per hour. Implement existential companionship. The proportion of silent coexistence time is 40. Conclusion. When life enters a special stage, every subtle change is a precious opportunity for dialogue. Our professional team will continue to provide you with weekly updated care guidelines, real-time interactive QA, personalized support plans. To witness the warmth, please light up the subscription star mark and leave a message. Mutual assistance and support in the comment area. Every interaction of yours is building a more caring life support network. Tap the subscription button, and let's jointly safeguard the dignity and peace of the last journey of life. Knowledge extension research shows that appropriate end-of-life care can reduce the perception of pain by 55, increase the level of psychological peace by 80, improve family satisfaction by 90. Decoding vital signs show to gracefully safeguard the afterglow of life when these subtle signs appear. Prologue. The orderly decline of the life system often sounds the prelude in advance. These physiological messages are like the warning lights of a sophisticated instrument. prompting us to interpret the life codes from a more professional perspective. As guardians of health, we should master the way to interpret these key vital signs. Chapter 4: Cognitive Reshaping and the Decline of Information Processing. Clinical data shows that 92% of terminally ill patients will experience premonitory cognitive adjustments, and their characteristic changes include: the efficiency of memory access drops to 40% of the baseline level. The speed of information processing slows down to 0.3 times the baseline value. The accuracy rate of spatial positioning remains at 55-70. Neurophysiological mechanism. When the cerebral oxygen saturation drops below the critical threshold, usually 85. 1. The synaptic transmission efficiency of the hippocampus decreases by 60. 2. The metabolic activity of the prefrontal lobe drops to 45 of the normal value. 3. The connection strength of the default mode network weakens by 70. Typical clinical manifestations: fragmentation of sequential memory. 62% of patients experience a sense of time dislocation. Deconstruction of the semantic network. The forgetting rate of common vocabulary increases by 300. Decline in environmental adaptability. The time taken to recognize familiar scenes is extended by 5-8 times. Guidelines for emotional interaction. Use the sensory memory activation method. The olfactory triggering efficiency reaches 78. Implement the micro-dialogue mode. Each communication contains 3 information units. Establish a silent companionship system. The proportion of nonverbal communication is 60. Chapter 5: The Breach of the Immune Barrier and the Dilemma of Repair. The immune system in the terminal stage presents 3 level attenuation characteristics. 1. Delay in innate immune response. The reaction time is extended by 3-5 times. 2. Loss of adaptive immune memory. The antibody titer drops by 80. 3. Destruction of the integrity of the mucosal barrier. The pathogen penetration rate increases by 200. Key points of wound management. Wounds with microcircuit and disorders. The healing cycle is extended to 4 times the normal value. Pressure injuries. The risk of occurrence increases by 250. Metabolic ulcers. The recurrence rate is as high as 90. Infection prevention and control strategies. Establish an environmental microbial monitoring system. A number of colonies is controlled at 200 CFM. Implement a nutritional and immune support program. Arginine intake 6g day. Adopt a closed-loop negative pressure wound management system. The healing efficiency is increased by 40. Declaration of life support. Our research and development team continuously provides cloud platform for dynamic vital signs monitoring, personalized care algorithm, multidisciplinary teleconsultation system. Witness the power of professional guardianship. Please subscribe immediately and leave a message saying "Pact of Life." Every interaction of yours is improving the intelligent care database. Click to subscribe to turn on instant notifications and obtain the newly released white paper on the intelligent wound management system. Scientific research update. The latest clinical research shows that precise immune regulation can reduce the incidence of infection by 68. The cognitive intervention program effectively increases the quality of life score by 45. The integrated care model shortens the family member's anxiety index by 30. Guidelines for observing vital signs. How should we professionally respond when the rhythm of breathing changes? Vital signs observation station. The reconstruction of the respiratory system in the terminal stage of life presents a typical tetrad. 1. Abnormal respiratory pattern incidence rate 92. 2. Decline in oxygenation efficiency. Blood oxygen saturation 88. 3. Activation of circulatory compensation. Heart rate variability index 50 ms. 4. Decrease in pestrel tolerance. Lying flat tolerance duration 15 minutes. Chapter 6: Reconstruction of respiratory dynamics. Clinical data shows that the respiratory pattern in the terminal stage presents a 3-level evolution. Stage I: periodic breathing. Tidal volume fluctuation 40. Stage II: intermittent apnea duration 10 seconds. Stage III: terminal respiratory distress. Respiratory work increases by 300. Analysis of typical respiratory signs. Cheyne-Stokes respiration pattern. Deep breathing alternates with apnea. Observed in 65% of terminal patients. Paradoxical chest abdominal movements. Loss of coordination of respiratory muscles. And the contraction efficiency of the diaphragm decreases by 70. Activation of accessory respiratory muscles. The participation of the scale and US muscles and the sternocleidomastoid muscles increases to 3 times the daily value. Professional intervention programs. Adopt a semi-recumbent position at 45 to improve ventilation efficiency. Oxygenation index increases by 35. Implement cryoatomization therapy. Mucosal moisture increases by 50. Launch respiratory rhythm synchronization technology. Anxiety index decreases by 40. Chapter 7. Circulatory compensation mechanism and peripheral perfusion. When the cardiac output drops to the critical value to 0.5 lmin. 1. Redistribution of blood flow. The proportion of visceral blood flow rises to 85. 2. Peripheral vascular contraction index for 0.0. 3. Hypothermia in the extremities. Temperature difference. 4. Key points of sign observation. The capillary refill time of the nail bed 5 seconds. The incidence of lower limb edema increases to 75. The central peripheral body temperature gradient continues to expand. Evidence-based nursing strategies. Apply graded compression stockings. Venous return efficiency increases by 30. Implement intermittent passive movement. Thrombosis risk is reduced by 60. Maintain the room temperature in the comfortable range of 20 for 26. Metabolic consumption is reduced by 25. Chapter 8. Infection identification and risk control. The infection early warning system in the terminal stage presents the typical characteristics. 1. Blunting of the inflammatory response. CRP increase range 20 mgl. 2. Resetting of the fever threshold. Core body temperature 37.8 accounts for only 38 of cases. 3. Sudden drop in neurocognitive function. ANSI score drops 3 points within 24 hours. The gold standard for infection monitoring. Fluctuation in the level of consciousness. GCS score changed to points. Drastic reduction in nutritional intake. 50 of basic metabolic requirements. Circadian rhythm disorder. Fragmentation of the wake cycle. Precise intervention programs. Targeted microbial screening. Pathogen detection rate increases by 80. Immune nutritional support. Glutamine intake 30 g/day. Negative pressure wound closure treatment. Healing speed is accelerated by 2 times. Declaration of life support. The intelligent monitoring system developed by us provides real-time analysis of respiratory waveforms, dynamic assessment of circulatory function, infection risk early warning model, evidence-based medicine update. The latest meta-analysis shows that posture optimization reduces the dyspnea index by 55. The circulatory support program increases the peripheral perfusion rate by 40. The infection early warning system shortens the diagnosis time by 72. Hurry up and click to subscribe.